In good health tonight, the Michigan Department of Health and Human Services has been in the headlines over the past 2 years as the former director was charged with involuntary manslaughter.
Dr. Frank McGeorge sat down with the new director in Lansing to see the direction he wants to see the department going in. Hey, Doc.
Hey, Sandra and Jason. Yeah, you know, this is a big deal. From the measles outbreak to the Flint water crisis to the opioid crisis. Those are just some of the issues this man right here faces. He's Robert Gordon, our state's new health director. And the response of the Department of Health and Human Services to those challenges is essential. Therefore, so is the director.
We talk about measles every day. I get a report every day, often more than once a day, about the latest numbers and the latest on what we're seeing.
Keeping on top of the latest outbreaks is just one of the things Robert Gordon is responsible for as the new director of Michigan's Department of Health and Human Services, a department that has faced severe criticism after its former director, Nick Lyon, was criminally charged in relation to a Legionella outbreak in Flint.
Your predecessor was officially charged and is going to court for involuntary manslaughter. You're not him, but what are your thoughts on taking on the mantle of what is obviously a very challenging position?
You know, my first day on the job here, I talked about the principles that I thought that we should honor were always listening to scientists, acting on data, treating people with dignity, respect, and honesty, telling it like it is, making sure we're careful with taxpayer dollars, and putting the interests of the public ahead of our own interests.
What are your thoughts moving forward on the issues facing Flint?
You know, I visited Flint in my first week, and I was there for the announcement of the Flint registry. And I think that as tragic and upsetting the history in Flint is, that the actions today in Flint are really encouraging. And our job moving forward is to do everything we can to support that forward progress. And we've provided support in past years, and we continue to.
Looking at the health of the state of Michigan, is there any priority that jumps out in terms of Michigan's health?
One of the central challenges that we have to tackle, of course, is opiates and the opioid crisis. And I think we have real opportunities with opioids, with obesity. And one thing that's quite encouraging in these domains is that we can make a difference.
Now, Mr. Gordon isn't a physician. He's actually an attorney with a really interesting background that involves two past presidents and Ruth Bader Ginsburg. So tonight at 11, I will have more on their connection and the priorities that he's setting for his department that does so much more than oversee just health. And that's going to be moving forward.
Yeah, a fascinating background indeed.
Yeah, exactly. You know, you guys aren't done with me yet, by the way. Tomorrow at 5, I have another story that I'm working on. I want to give you a little update on that.
It's similar to keeping an armed weapon in the reach of your children. You know, I think these are deadly medications. They're addictive medications.
A local hospital system is trying to reduce the risk of opioid addiction and help patients battling chronic pain.
We have a free community event, and it's really to educate people about a non-opioid approach to managing pain.
Tomorrow at 5, see how you can help fight the opioid crisis and learn about options to ease pain in a safer way.